public sector organizations have been adopting and exploiting robotic process automation. That's the new generation of software tools that can speed up routine processes by following a set of predetermined rules. To introduce myself, I'm Elaine Nutt. I'm a freelance journalist, and I'm going to be moderating this webinar on behalf of Global Government Forum, the website that serves civil servants around the world. Many public sector agencies have turned to RPA as part of their response to the COVID-19 pandemic. This has brought a need to roll out new online services at speed, often to support citizens whose livelihoods or businesses or welfare needs have been affected, or to create tools that directly support the coronavirus response. Because RPA can often be deployed rapidly, it can make a difference to service users or customers in a matter of weeks or even days. Some adopters have reported impressive efficiency savings or return on investment. But RPA is often thought of as a human replacement technology. Essentially, an RPA tool will do the same tasks as a human worker might, but automatically and without any human intervention. So there are two sides to that coin. On the one hand, organizations can make efficiency savings or avoid hiring new staff to roll out new services. On the other hand, the very name of robotic process automation taps into our collective insecurities about robots stealing our jobs and can be perceived to be a direct threat to existing employment patterns and job security. We'll also be looking at what kind of projects are best suited to RPA and the kind of projects that fall outside its scope. RPA works well with structured and predictable data, for instance, but what happens when organizations need to build applications using data that has lots of exceptions or is unstructured? And we'll be discussing whether COVID-19 has accelerated the kind of digital transformation that public sector organizations have been discussing for years, and if so, what the next couple of years might bring in terms of deploying RPA and other automation technologies in the public sector. Before we begin the discussion, I'd like to thank our knowledge partner, the IT services provider NetApp, whose support enables us to offer this webinar free to public servants. NetApp is known as a data storage and management solutions provider, but it also advises on and implements solutions for data integration and automation. The webinar will begin with presentations from each of our four panelists, then we'll leave plenty of time to take questions and have a discussion on the issues raised. So this is your chance to have your queries answered in person by the panel. As questions occur to you, just click on the Q&A button at the foot of your Zoom window and type them in. I'll keep an eye on it and we'll get through as many audience queries as possible. Please do add a note there if you don't want me to use your name as I put the question. So it's time to introduce the members of our panel. First of all, we have Mikko Laakso, who is the director of the Finnish Tax Administration, which has been using RPA since 2015. We also have Lakri Cortez, who is General Director at the Ministry of Labour, Family and Social Protection in Romania, and who led an RPA implementation team for Romania's National Agency for Employment. Then we have Jack Watts, who is the Business Development Leader for Artificial Intelligence in the EMEA region at NetApp. And finally, we have Gina Maini, who is a digital service expert at the United States Digital Service. Gina will tell us more about the service and discuss a project that has transformed access to Medicare data there. So Mikko, if you'd like to start us off, we're looking forward to hearing about RPA in the Finnish tax system.
Thank you, Elaine. So if I could see the slides, thank you. My name is Mikko Laakso and I work as a head of ICT development unit at Finnish Tax Administration. Next slide, please. So here is a timeline of our journey with the RPA. And I think one background knowledge is important when you are following this timeline. Alongside with this timeline, we were modernizing our taxation systems. So previously we had around 70, 80 legacy systems tailored for us. And we started implementation project for the commercial off-the-shelf product in 2014, which is exactly aligned with this timeline. So at the same time, when we were implementing robotics, we were modernizing our IT systems with commercial off-the-shelf solution. So our journey actually started with automated testing processes that we did when we were implementing and doing quality assurance for that project where we implemented that commercial off-the-shelf taxation solution. So that was our first touch to the robotics. But from the business point of view, we started to evaluate the possibilities of automating business processes around end of 2015. And we made a small demo to introduce this technology to our decision makers, and that got green light. So the next step that we did was a feasibility study, try to find out possibilities and use cases for robotics. And based on that feasibility study, we found something like 150 cases, and we did a proof of concept procurement and selected three areas, three processes for that. I will tell a little bit more about that later. And those were successful, so we put them to the production, and then later on got our own platform for RPA. And current state of our RPA production is that we have 6 licenses, meaning 6 robots running 16 processes. Next slide, please. During the feasibility study, we found 4 different use case categories, and those are mentioned here. I think the biggest one is the mass manual work category, where we are trying to get rid of unmotivated tasks, repetitive, monotonous tasks. And one of the kind of a thing that we found out was these hidden tasks, some things that we don't have resources to do, but would be useful to do, and maybe in the later phases of the processes will be problematic if we haven't done those. So that was one of the findings. And pull data, we are just pulling data from the different sources. That also helps in the different processes. Next slide, please. Here's one slide about the proof of concepts that we did. The idea and the target, the objective was to introduce ourselves to this technology and different platforms that are doing it technically, and also different suppliers and vendors who provide these services. And we managed that by doing 3 different POCs, using 3 different vendors and 3 different platforms to learn ourselves. Next slide, please. So the way we see this at the moment is, like I said, in coexistence with this journey with RPA, we were modernizing our taxation system, and that system is called GenTax on the picture. So mostly robotics is nowadays is used to reducing and eliminating routine work, and making sure that our tax officers kind of can put their expertise to more meaningful tasks. But in doing so, we have other means, not just robotic automation. We also use our GenTax system. We use artificial intelligence, advanced analytics, and kind of more traditional ICT methods like creating batch jobs and such. And also, sometimes it's not about technical issues. You just have to streamline your processes in real life, and we use Lean for that. So that's the brief introduction for our journey with RPA in Finnish tax administration. Thank
you. Okay, thank you very much, Mikko. That was great. Thank you for the overview. And yes, perhaps in the Q&A we'll pick up a bit more on the applications of RPA and some of the other automation technologies you talked about there. If we could move on to hearing from Lakri, that would be great.
Hello, my name is Lakri Cortes. I'm working now in the Ministry of Labor and Social Protection of Romania as General Secretary to the National Agency of Employment. Next, please. Next slide, please. And But I want to tell you a story about how we used RPA with the National Agency for Payments, which is our structure, Ministry of Labor and Social Protection from Romania structure, which is doing the payments for all social benefits from the state budget to all the Romanian citizens. As well, it has another task to monitor and control the social services, but today we are going to talk only about the payments of this agency. Next slide, please. Shortly, the mission on payments of this agency is to cover with the social assistance and social benefits all the citizens in need. That means is working with 42 agencies in the 42 counties we have in Romania. The procedures are done through an automatic system named Safir, but this Safir is old enough. It was put in place in 2007, and it's still working. Of course, it was updated, but during the crisis, the crisis of COVID-19, we had to take some decisions, and I will tell you about them immediately. Next slide, please. This is the structure that National Agency for Payments is a subordinate of Ministry of Labor and Social Protection. Thank you. Which is working now with 1,500 employees, about 30 in each county and 100 to the national representative. Next slide, please. But with this very few human people with such a scarce human resource, we succeed to pay monthly about 5.2 million beneficiaries. That is IDs, unique IDs, and the yearly amount is about 3.8 billion euros. Next slide, please. But what happened when the pandemic occurred? We had to take a decision because all those money, with the help of Safir, the IT MIS system we have in place, it's not enough to cover the measures the government took to face this crisis, sanitary and economic crisis, which occurred. So what happened? For the period 15 March, 15th of May, the government declared emergency state in Romania. And in that time, on 21st of March, an emergency ordinance was issued, which allowed for the employers, either they were employers with many employees or for the self-employed, to be supported by the state with some percentage of their income. As you can see, technical unemployment is established at 75% from the salary, and this gonna be paid by the National Agency for Employment, and for the self-employed people, 75% from medium salary, but which gonna be paid by the National Agency for Social Payments. So two entities, different, but both of them subordinated to the Ministry of Labor and Social Protection, and they addressed different target groups. Next slide, please. I will talk only about the self-employed, but because this part of the economy was helped by the National Agency for Payments, and the number of beneficiaries which we had paid in this period from March to August was 2,450 and 519 beneficiaries, and the amount paid was about 38 million of euros. Next, please. So you can imagine it was a very, the payment was done on monthly basis, and according to the law, each potential beneficiary should apply for this somewhere between 1st and 10th of the month. And in the next 10 days, the agency should respond and give the payment to the beneficiary, to the self-employed person. So we had to act very quickly. That is why around 30th of March, we discussed with UiPath and we started the discussions. After a few days, only on 2nd of April, we have received from UiPath the RPA, and it's starting the work on their programming. Actually, on 9th of April, we had around 9th of April, we started the development phase. In 15th of April, so in such a short time, we were able to start the testing. Iași and Botoșani are the counties which were selected for this test of acceptance. And after that, after 12 days, as you have seen, around the 27th of April, we scale for the whole country the experience which was done in Iași and Botoșani counties. As you can see, in 1 month, we succeeded to, this is from moment 0 up to the moment when everybody in the national agency was able to put in place the automated process. Next, please. The challenge we were facing was for 1 month to receive and to process about 110,000 payment requests from the citizen, and as I said before, to process them in 10 days time frame. What all the 42 regional authorities had to do in these days to validate and process, then to send all via email or via in different formats, or to have missing documents or inconsistent information to send and receive. This was like a ping pong game with the employers, and all these processes were saved and were not done anymore by manual work, but they were took over and done by the robot, as we said. Thank you. Next. So what happened actually? We just log into the web platform, then we download the intelligent PDF submitted by the requester, we validate the information, and then we write the output in an Excel. This was, we said, now we say it was done by us, but in fact it was done by the robot, actually by the 38 attended robots which we had in each county. There were, as you can see, 4 counties which were not using the robots in the first month, but after that, seeing the success story of all the other 38 colleagues, they joined the team as well. What the robot done more, it sent an email notification with the results and an answer back to the beneficiaries. The request was validated or invalidated, so it was divided into 2 files, and like this, the processing time was reduced from about 15 to 20 minutes, which were necessary to a worker, to a public servant, to evaluate the file for each employer, to 36 seconds. Next, please. So the results are very well shown by these figures. For the 110 requests received each month, roughly, we had only 14 days to implement. We succeeded to have 95% of transaction automated. We eliminated the human error Also by 96% the error which was tended to have, and as I said, 30 out of the 42 counties used the solution first, but then all the 42 took over this solution. Next, please. So it was speed work which was done, and all the unemployment applications and benefits were processed. Which was the problem we faced. The training of the human resource was done in very short time, also with the pressure we had from the sanitary crisis, and of course the psychological resistance from our colleagues in the first month when they were afraid of how the robots will steal their work and their job. But finally, they have seen the advantages and the time which was left for them in order to make more complex work and all these repetitive tasks to be done. They understood that is compulsory actually, but also very well for their psychological status to be done by a robot. So they become friendly with friends with our robot. Next, please. Which are our future plans to put all the repetitive processes we have also in that old system, MIS system we have in place, Safir, as I told you about in the beginning of my intervention, to everything to be automated. This is our plan for the National Agency for Payments, and also to replicate the experience to the National Agency for Employment, which is the other big institution of the Ministry of Labor and Social Protection, acting on the field of protection, the employers and the employees actually. Thank you very much, and I'm expecting your questions.
Well, thank you very much, Lakri. That was obviously a very positive case study, and great to hear the results there. And I think when we had a chat before the webinar last week, I think you told us that you received a promotion as a result of the project. So congratulations on that as well.
Yeah, actually I was sent to the National Agency for Employment to implement the RPA as well as I did it to the other agency. So to replicate, I am the replicator.
I see.
Replicator agent. Thank you.
I see. Okay, well, thank you very much. And there's lots of points there that I'm sure our audience will want to pick up on in questions. And now it'd be great to hear from Jack Watts from NetApp, who's our knowledge partner for this webinar.
Thank you so much, Elaine. It's a pleasure to be here and speak on behalf of NetApp to the Global Government Forum's audience. Robotic process automation in our minds has actually already been delivered in one of our platforms, which we call Active IQ. So this takes essentially telemetry, which we get access from our customers from their storage arrays, and of course all the data processing that's being done in the cloud. This allows us to give best practice advice back to those organizations in terms of how they should actually follow and automate firmware updates, as well as predict when maintenance needs to happen on particular systems. So there's lots of AI that's been developed in the background to actually learn and discover what a good system looks like versus what a really good system looks like, and what systems could actually be a potential issue. And how we do that is we also have a look at what workloads customers are using on their systems as well. And this is a really insightful process that we can actually give back to the organization to say, look, you're using your workloads here, there, and there. What we advise is actually if you move all of those workloads to a particular location, you'll actually have a better efficiency of either data compression in terms of cloning, caching, and then also serving compute-based infrastructure. With that segue, that actually leads me on to talk a bit more around what NetApp is doing in the wider scheme of artificial intelligence. So I myself have been in the artificial intelligence realm for nearly 6 years now. Previously, I worked at NVIDIA, which you may be familiar with as the AI computing company. I'll put that in quotes. But certainly, what's quite impressive there is that, you know, the availability of big data has been a real sort of sea change in the way that RPA can now be delivered, as well as various other AI tasks, whether it's healthcare, automotive, and so on. But in the public sector, it's incredibly important that, certainly from an AI platform perspective, that decisions are made around delivering efficiencies to data scientists, their teams, and actual workloads. Because when it comes to proving those concepts at an early stage, you know, you may be doing it on a laptop, you may be doing it on a gaming PC, you may be doing it on an instance in the cloud or a server that's in your broom cupboard. But when it comes to piloting those projects, those experiments, working on more meaningful data, you're either bringing that back down onto an on-premise solution, or maybe even opening up a larger instance in the cloud. It all really then stems to data mobility, provenance, security, which are all things that we're able to deliver as an organization. We're so proud to be partnered with a lot of incredible independent software vendors which offer middleware platforms alongside ourselves in terms of being able to provision and orchestrate these resources. So what that means for you is that essentially you can take POC, move to pilot really quickly, and then when it comes to scaling at alpha and beta testing before going through model validation, it's a really great process to then have a look at a great procedure to have a look at and make sure you're understanding what data set versioning you've got, model variations, and make sure that's all tracked and traced all the way through. Because when you're out in production, you may recognize that there is some kind of bias or issues, certainly when it comes in RPA, of potential erroneous systems. So you want to then be able to go back and check, not necessarily who exactly trained it, but certainly what data set was used, how the model was built, and then how the model was validated, because then you want to be able to then go through and then of course correct those issues, change the data set perhaps, and then push that further up. So I read that what my ask to the public sector is to really consider what a good standard of AI platform looks like, so you can give the best tools to your scientists and they can have the freedom of experimentation. That's really what it all boils down to, because if the data science community don't have that freedom to experiment, they're completely restricted. So please build good quality, best in class AI platforms. And I think that's a good segue into what Gina's going to talk about. I'm really excited about that one. Thank you, Elaine.
Okay, great. Thank you very much, Jack. Yes, I think in the Q&A session, we'll have a chance to talk a bit more about how the data science community and the public sector can, best work together. And so, as you say, on that, it'd be great to hear now from Gina Maini.
Hi, so I'm going to be talking about, from the United States perspective of digital services, how has RPA affected our response with COVID-19 in the United States. Next slide, please. So this talk is really going to be very quick, just trying to keep it to five or so minutes. Who is my agency? Who am I? What have we worked on in terms of RPA that I can talk to you about today, and then leave time for questions. Next slide. So USDS, if you go to the next slide, I've got a quick definition of who we are. But basically, we're a cross-cutting federal agency that gives expert technology advice to different arms of the US government. And we tend to do embedded engagements where we'll work with that agency long-term and set up kind of a digital services shop. So we sort of spread out and kind of grow organically as we make connections and work on different projects with stakeholders. So even though I'm from OMB, which is the Office of Management and Budget, I actually work at Medicare full-time And before Medicare, I also worked at Department of Homeland Security on asylum adjudication, which is a great case of RPA that I probably won't get to talk about today, but where we built basically a technology that adjudicates asylees quickly and with a high precision and generates legal documents for an asylum officer. You can see in a backlogged refugee or asylum system how many lives that can help, and how many people were impacted by automating a simple legal doc generation step. It took, a process that would take an asylum officer 3 to 4 hours, and now that they could do it in 5 minutes. So that was a really big change, big game-changing RPA work that I did, but mainly I work on Medicare these days. So next slide. But yeah, we have people all over the government. We have people working with veterans, people working with, in my case, my team at HHS, Health and Human Services, we work with doctors and patients and researchers in different medical specialties. But like I said, I worked on asylum. So I was working at USCIS inside of DHS, which is like immigrants and stuff like that. But we have people at SBA, we have people everywhere. Next slide. So I specifically work on modernizing the payment system in Medicare, which is a series of mainframe systems that analysts that the government authorizes to adjudicate Medicare and to run the claims for healthcare claims. So that's all done on mainframes, and they're very old mainframes. And so you can imagine that during COVID-19, a lot of those systems saw load, certainly with the number of people who would be applying for government healthcare after losing a job. So specifically, this work wasn't totally related to COVID-19, but it's pretty important in context. Mainframe modernization is a big chunk of the stuff that I work on full time. And making the mainframe more modern. So automating mainframe logs to page someone in the middle of the night, the same way that you would with a cloud system. So that type of work becomes really important in COVID-19 times. So next slide. So just some quick stats about Medicare. I know for some people listening who don't know the US systems or acronyms, I don't blame you. There are many. Medicare here, when I say it, is not like Medicare in Australia. Medicare here is Medicare, so healthcare for people who are disabled or over 65. So we have 53 million Medicare beneficiaries. There's also something called Medicaid, which is state by state, and that's different. That's how people would get a public option. It's all very complicated in the US. Healthcare is very complicated in particular. But suffice to say, we have a lot of different ways to get healthcare, sort of, and they're all compiled under one agency called CMS, Centers for Medicare and Medicaid Innovation, and that place. So that's all CMS. And anyway, so 53 million beneficiaries. That's how much money we move from the Treasury, 500 billion every year. That seems astounding, but that is the size. And yeah, we have 1.2 billion claims per year. And if this project goes poorly, well, that affects 4% of GDP. So this project is something that could cause a recession or help us get out of a recession or something like that. It's pretty massive scale. Next slide. But really, at the end of the day, this is who we're trying to make this system better for, right? It's for people, the average people who need to access these systems and have better APIs, better ways to communicate with these legacy healthcare mainframes, to understand the status of their claims, to understand where their claim is in the system and what their options are. What are they eligible for? Eligibility is a big question around us in terms of APIs. And so we've worked, US Digital Service has partnered with CMS on a number of different API products, data at the point of care. We've delivered modern HTTP APIs on top of old old legacy Medicare software. So we continue to innovate and pull out data and make data more available, because as you heard from our previous speaker, that's probably the most important job that government can do, is get out of the way for experts to come in and actually analyze this data and get out of the way for innovation to come. So next slide, please. Right, so this is some of the APIs I mentioned, and of course we are serving up our legacy claims data, which is on mainframes, and giving it out to all of these different people who need to access APIs. These people have different authorization levels, they have different needs in consuming their data, so we have to take all of that into account and come up with the best solutions possible. And so I think what's been exciting is, in my tenure of like almost 2 years at Medicare, we've really started to answer a lot of these questions and think about API standardization and how we can have more automation and less services, but more integrations really between these services. Have more of we like to think of it as like API driven culture, or API driven product culture. Because the problem with government that I didn't realize before I had worked in government is that there often aren't products with users. There are often just policies, which have no sense of user and no sense of context about how the policy affects real people. So these are exciting ways that we can start to connect policy to product through APIs and connect users to how people use those APIs. So it's really a product change that we've gone through. Next slide. And yeah, just a little bit about me. That's my name. Next slide. I specifically have focused on helping Medicare have more engineers on staff. This is a bunch of jargon from another talk I gave about local coverage determinations and national coverage determinations in healthcare, which is something when you have states which give healthcare laws that are different than national healthcare laws, well, who wins, right? Great question. Well, we have rules engines for that. And so a lot of automating that and doing fraud analysis on it requires data collection. So I've done a lot of work with automating everything that happens in healthcare. And also beginning like a site reliability engineering culture at Medicare, as well as starting DevOps teams. So there's a lot of contractors still and very few feds, but that's why it's so important to work for the government, as you all know. Okay, next slide. And yeah, it's all been really easy, right? Like it's easy. Well, not exactly. It's been hard. I've been doing it for a few years. Next slide. But some exciting things that I've done or things that I found while working at Medicare is I did really cool analysis work on, we have this type of healthcare in the United States called inpatient rehabilitation, which is really hard to say. And it's called IRF internally, inpatient rehabilitation pricing. So for those types of facilities, they are not hospitals and they are not outpatient, meaning like you would go to the doctor who's a specialist on your own time or something. That's what we call outpatient. Inpatient means you go to the hospital or something. So there are residencies in the United States where maybe you've had a stroke or you've had some procedure where you need full-time care, maybe as you're rehabilitating after surgery. But you don't need to be in a hospital where you'd have access to full-time medical staff. That really doesn't exist anywhere else in the world, but it exists in the United States. And so I did a lot of analysis, really instrumenting at every step of how a claim moves through Medicare, monitoring and collecting that information, and then really framing the life cycle of a claim for policy owners. So now the person who works on IRF gets an email every week about how many claims were run, or how much was a certain type of mixed group code pricing, how did it price this, and they've never worked that way. That was a team that traditionally only looked at data maybe once a year. So that's really an example of bringing like policy, data-driven policy into practice. The other things on this slide here, just making mainframe data as usable and accessible as cloud data. This really does help us get to a fully cloud government services, just because it gives people a transition step where they can compare previous year programs to future year programs. And I think that's a really key step when you're transitioning architecture off of a legacy system to the cloud. And yeah, also just working with great people in the US government. I've learned a lot working in government, specifically how to write emails. I didn't know how to write emails before that. So, you know, being an engineer, you know, usually you don't leave the computer, but at my job, I talk to a lot of people every day and write a lot of emails. So it's a very different style of job, but I really love it, and I've grown a lot on this job. So anyway, the next slide, please. And yeah, why do I even work on Medicare? Why not work in the private sector and make a lot more money? Well, my passion is from my mom, who had to use Medicare. She was a Medicare beneficiary who had brain cancer. And after being with that experience of using the US healthcare system, I really decided that enough was enough, and there was massive change that needed to happen, especially heading into this election season. We'll see what happens with the future of Medicare. But it's been a really exciting project, and with big impact, which is always why we keep coming back to government. Anyway, next slide. And I think that's it. Although most of you are not US citizens, I do have an apply link in here. If you know anybody who's applicable to apply, or you're interested in knowing more about us, I really do encourage you to check out the materials that we have on our website. So thank you.
Thank you, Gina. That was great. Thank you very much for that, and also for bringing it back to the personal dimension at the end, which is also relevant for everybody. So thank you to Gina, and thank you to all our panelists for their contributions. It's been a really interesting discussion so far. We've got one or two audience questions, but if a member of the audience who'd like to put a question direct to the panel, there's still a chance to do that. You can do that via the Q&A button at the bottom of your screen. So please don't hold back. But before we turn to audience questions, there's a few general questions that I'd like to put to our panelists, and continue some of the discussions we've been having. And one general question that has come up in a couple of the presentations is how can public sector organizations and the world of software vendors and data scientists work together better? What do public sector organizations need to do? What capabilities, what systems, what attitudes do they need to have to make the most of the new technologies and the new approaches that are out there? So I don't know if any of our panelists would like to take that on. Nico?
Yes, I can answer that question from our behalf. I think communication is one of the key things here, because when this kind of new technologies are introduced to your employees through websites or news or seminars, it's not as good as you are delivering it internally, because then you can tell the story from their point of view, because the question is always, how does this affect me and my work? So communicating what is RPA, for example, as a technology, what it's meant for, and how it's positioned in your organization, and communicating that is really important. For example, we told that we are not going to steal your job, we are going to make your job easier. We are going to get rid of all the nonsense so you can focus on the key issues on your work. And also, we have this strategy that, like I mentioned, we have already modernized our system. So most of the automation will be done inside Gentex. So we told that this RPA is for us kind of a band-aid, temporary solution. So I would say one of the key things is communicating inside your organization to make this happen.
Yes, so communication being the watchword there. And Jack, is there anything from your point of view about how your community what it would help in terms of working better with public sector organisations?
I think it largely comes down to guess what data and the collaborative means that organisations need to have. Something that's fairly recent, but not really in terms of its initial concept, is around federated learning. And this specifically in the healthcare sector is revolutionary as a blueprint where healthcare organisations can share their patient care image data essentially without actually sending it to another location for the purpose of training cancer image models and detection models. That is extremely powerful and something we're deploying ourselves with King's College London alongside our National Health Service. So something that Medicare could maybe adopt themselves. But certainly in terms of its initial concept, it is all around collaborative learning and transferring weights from one machine learning model to another and really just having a super model, I call it, or a master model, if you like, trained on millions upon millions of data points with incredibly high accuracy and robustness to detect cancer is paramount. Empowering the radiology workflow and really allowing us as a society to lower the mandatory ages for cancer examinations. AI, I'm sure we can all agree, will have the most impact societally in healthcare. But that then as a concept from a collaborative data point of view can be applied to any industry. And that really enables data science as a concept to thrive, in my opinion.
Great, thanks very much for that. Lorky, if I can turn to you, because one of the things that you mentioned in your presentation was about attitudes from the staff to the deployment of this new technology, and some issues and concerns around the deployment of RPA. Can you tell us a bit more about how your organisation set about winning the support of the workforce?
Okay, no. As you pointed out, it was kind of a resistance from some of our employees. They were afraid, first of all, because some of them were not so good in using technology and computer, and secondly, because it was like a rumor, even when Henry Ford put in place his automated process, which was at that time 100 years ago, when rolling out cars for the fabrication of the cars. Even now, the people have this in mind, that whenever an automation comes, their job is in jeopardy. So how we dealt with that, we had some sessions with them. We convinced them that their job is assured, and this is just a help, which it's for us the tool which will allow to really handle all these tasks, which are supplementary tasks, because all the payments which I talked before were and come into the picture on top of our usual work we had to do. So we had at that time, and still we have now, the regular job, which is done perfectly, and we are dealing with a lot of money, as you have said, as you have seen. And these supplementary tasks should be done in a very short time. So we explained them that with the communication Miko told before, this was really the key in our organization as well. Through communication, we succeeded to explain them that this is the only way to achieve everything, our regular job and this supplementary job task which came for us and in these tough times.
Great, thank you. Yes. Does anybody else have anything to add on communicating with staff and communicating the wider agenda? No. Well, we've got some questions coming in from our audience, which is great. We'll turn to those in a moment. But just in general terms, the title of the webinar is RPA and COVID-19. I just wondered if the panel could comment on whether they see that COVID-19 and the challenges the coronavirus has brought has sort of shifted attitudes to digital transformation in the organizations that they're working with. Clearly, that we had an example of that from Lakri in Budapest. Sorry, in Bucharest. But in general terms, do you think it has accelerated interest in digital transformation? Are people more willing to change things because everything around us has changed anyway in the era of COVID? I wonder if we have some views from our panelists on that.
If I may take just to connect with what I have said before, yes, after the first fears in the first weeks, which, as I said, we roll over after with communication and long discussions with everybody, each and everybody. Now, after 2 months, the 2 first months, now we are in a different picture because everybody wants that, and they ask to their leaders to implement it, and to all other processes we deal with in the organization. So if we may say that COVID-19 has something good in it, it's that the change will be implemented in the organization from the bottom to top now after the first two difficult months which were in the beginning, but now the things are changing. So in the beginning, from the top to the bottom, we impose the change through RPA, using RPA, and now it's everybody, all the human resources are asking us to come with as quickly as possible with new solutions similar to these processes we have applied. So from this point of view, we may say that COVID-19 is for us a good story.
Okay, thanks for that. Miko or Gino, Gina or Jack, anything to add on the direct impact of COVID-19 in thinking in your organizations?
Yeah, I can elaborate a little bit about our situation. Of course, this was really special thing that happened with the COVID-19. So of course it needed really special measures also to tackle those. And I think the main thing was the speed at which we were expected to change things. And I think we learned a lot, and we were able to answer that call in many situations. We were really fast, everyone working at home, and we didn't let it kind of slowed things down. We still kept developing and supporting our systems and such. But at the same time, for example, taxation in Finland is people pay their taxes and they do trust tax administration. So when we put the speed a notch higher, we have to make sure that we also concentrate on the really important things behind that trust. And those are privacy, security, and availability of those services. So even if we are in a kind of crisis and we are in a hurry to make things happen, we still have to remember to make sure that those things are taken into consideration. That's something that I learned. We have to be fast, and we were, but we still cannot forget what things are the most important when we are implementing fast, rapid solutions.
Yep, that's a great point. Jack, have you seen direct impacts of COVID-19 in the way your organization is responding to client needs? What has changed in the past 6 months?
So at NetApp, we've always had a kind of hot desk type approach to office work. So we, as an organisation, we were very quick and very lean and able to work from home very quickly. What we were noticing from our customers and fellow organisations in the public sector was the business continuity. Right, everyone needs to work from home. How do you then have 500,000 employees or 200,000 employees access a VPN network that can only serve 10,000 employees? So that was something that really started to stagger and grow when it comes to data center requirements. But continuity was key. Data generation is still there. And it's all about, again, that privacy, the data provenance, where it comes from. So it was a really interesting change that we've been able to see. I'm interested to see where this pandemic goes and where it kind of leads us. But I totally take on Larcy and Miko's points specifically around the speed and the agility that organisations need to operate at now to respond to this pandemic.
Great, thanks. And Gina, any sort of comments on how the US Digital Service responded to COVID-19? Obviously, possibly broad question, but any sort of general points that you'd like to make?
Yeah, so we really have worked with everybody. It seems like, from the Small Business Association, having a website crash for businesses filing for employment relief and tax relief, to every single I think we were doing 7 or 8 different states every week that we would be on a phone with, talking through their unemployment systems, which had crashed because they had seen such unprecedented load, to me directly advising. We have a project called healthcare.gov, which for those who don't know, is a website where today anybody in America can apply and get healthcare on healthcare.gov. There's certain life events, namely if you move or a death in the family, that can qualify you for a special enrollment event where you can then get healthcare. So we had to completely go back to square one on thinking through projections for load during the next open enrollment. And so, we went back and forth. The healthcare.gov team really stressed about what was the right number. How many people could you expect to get healthcare? And there's a lot of different variables that went into that. But ultimately, we advised them to not focus so much on the unknown unknowns, expect the worst, triple it, and then actually just run your systems at scale and stress them and see what falls over, and then kind of piecemeal work on what's falling over, because that will get you the more value than picking the right number and agonizing over the number. So lots of different ways that COVID has affected our work and will continue to affect our work. My entire agency is remote, and we used to only meet in DC, in our historic office. And of course, it's lost some of its appeal now that we all have Florida as our backgrounds. So.
Yes. Okay, great. Thanks very much for that. Okay, if we can move on to some questions now from our audience. And one question came in advance, so I was able to tee up our speakers on it. But a questioner from Australia is referring to problematic rollout of an automation tool in Australia, which I gather this tool was trying to reconcile data held in Australia's tax system and Australia's welfare system, And when the tool detected a discrepancy between income reported in the two systems, it would send a letter out to the individual demanding repayment of money. And this was not necessarily, in fact, owed. So essentially, the question is, if an RPA tool has some kind of error built in, then what safeguards are there to prevent that error being replicated again and again? And how can organizations prevent this kind of problem happening? So I'm sure this is something that everyone can comment on, but Nico, can I turn to you first?
Yeah, okay, that's a good question. And actually, when introducing RPA, that's a comment that you often come across, that if a person can do 200 cases per day and a robot can do 20,000, what if the robot does it wrong? So after the workday is done, we only need to fix 200 cases if it was done by a person and 20,000 if it's done by a robot. But the whole idea is for us to automate and bring efficiency to the processes. So that is something that you have to take into consideration when you are thinking about the quality assurance of that automation. So there needs to be, I would say that the best ways to prevent this are preemptive measures, including putting test automation, putting measurements, estimating the workloads, for example, putting thresholds. If the estimation is that this robot should process 2,000 cases per day, and for some reason it's going to process more than that, and if we don't have any threshold or monitoring that will alarm us or stop the robot when it's doing 20,000, then it might be harder to roll back and correct all those mistakes. So trying to preemptively find out and monitor those would be the best way. But then the second way is to build ways to make the correction also automatically. So there is no scenario where robot makes 20,000 mistakes and then persons have to manually correct those. So this is just a planning, but we have to do this no matter which technology we use to automate our processes. This is a really important part to monitor and react when something goes wrong.
Yep, that sounds important. And Gina, is there anything you'd like to add there?
No, not entirely. Someone did ask me something about a question though. Should I answer it now or later? Sorry.
Yes, the question was about data security, wasn't it?
It was, this one said, internal CMS systems, to what extent are you leveraging APIs versus scraping and sending by other techniques? Any best practices that you could share when making the determination on how to process and transfer data? So that question, really good one. I feel like that could be like a really long discussion, but I'll just shortly say, we get data from a lot of different places. We're trying to do a type of collection where it's structured, where it takes the input up front, so that we have structure when we query, and it creates like a coherent layer for people to listen to our data for. I'm being like overly vague, I guess. I don't know why, but I don't know a better way to say that. But yeah, we're doing a highly structured format up front. So we're going to use like a schema registry for people to like listen for changes to their data, see new data, and listen to an event bus. But yeah, largely all of that's going to be over TCP. We don't have like transactional screen scraping, if that's what you're asking. Although a lot of Medicare does operate through that today, where you'll run a job a COBOL job that'll screen scrape against a green screen. Although that doesn't really scale well. And so obviously we're not going that approach, and we're going instead at the actual file system level of the mainframe. So hope that answers your question.
Okay, great, thank you. We have another question from a member of our audience. Jenny is asking if any of the organizations have plans to further embark on hyper automation, and if you have what kind of use cases are you deeming appropriate for hyper automation? Yeah, so I guess that takes us into the next steps. We've been talking about RPA, but there are also other forms of automation technology. Would any of our speakers like to take that up? Nico, because your organization is looking at other technologies, machine learning, that sort of thing.
Yeah. I was struggling with the hyper automation term because I'm not familiar with it. But if it means that automation is moving towards more intelligent implementations, yeah. And if it means that AI and machine learning algorithms are going to the picture, yes, that's something that we've been doing proof of concepts, and for us in a Finnish tax administration, natural language processing and handling of unstructured data is one of the big use cases, both in a customer service, which is huge. We need to serve our client customers, and also in just a taxation. That's really important. But the thing that we have to be really aware of and have to go hand in hand is the regulation and legislation, because at the moment Finnish legislation for which all the taxation is based on doesn't recognize artificial intelligence, and it also lacks just a basic automation of these tasks. So at the moment, I know that there is an effort going on where they are renewing the taxation, legislation about automatic processing of these decisions. But that's something that restricts us at the moment a little bit. But when we use AI, for example, as a part of the process, not making the initial and last decisions, then it's okay. And we also have draft, because one of the key issues, I think Jack mentioned that there could be a bias, because we are using a large number of data. We have to be sure that the data we are using is valid and it's not biased. And so we have drafted already, maybe 1 year ago or even longer time ago, our ethical kind of principles when using AI, and that will play a really important part of the future of automation, to make sure that the regulation and legislation are in place, and that even though those are in place, that we still do things ethically and make sure that the privacy and security I just mentioned, that are the keystone for our trust in the taxation. Those are really important for us moving forward.
Okay, great, thank you. And Jack, if I could turn to you, because I think you made the point that RPA obviously often happily coexists with other forms of automation. I'm not sure whether you're familiar with the term hyper-automation, but is that something you could respond to?
I had to use a good friend of mine, Google, to have a look at hyper-automation. I'm not a DuckDuckGo fan at the moment, but yeah, that's probably a topic for another day. But certainly, hyper-automation, to my understanding, is implementing process mining as well as various other techniques, combining those to actually make decisions. So this is really taking out the humans in the loop there. Personally, I see it a little bit dangerous as we are in this kind of nascent stage of RPA. I think as things get more improved and biases can be removed, and certainly processes can be improved, then we'll certainly see these processes starting to hyper automate. But I love the term, and what a question, Jenny. Thank you.
Great, thank you, Jenny, for introducing us to a new term. Well, it's getting towards the point where we'll be wrapping up the webinar. But before we do so, I just wanted to go around our panelists again and just ask them to sort of think a little bit into the future, and if they could sort of nominate one change or one shift that they think would help public sector organizations release the benefits of RPA and allow our governments and public sector agencies to fully exploit the potential of the technology. So if I could just ask our panelists one at a time what one shift or one change they think would be positive for better outcomes. Jack, if I can start with you.
Thanks for that. So from my perspective, I think it really has to be the democratization of access to tools and really just giving data scientists the best in class access so that they can do the experiments that they need to do. I can't remember what specific percentage it was, but it was a very large one that IDC found in terms of in general experiments around AI, RPA, everything. A lot of them fail because of the lack of ability to scale. And obviously then when it comes to privacy concerns and data sovereignty, there's a lot of elements there. So I think if there's one change that the public sector could do is really to democratize that and keep investing in AI for various different sectors. I love the fact that that Larcy's been able to really, it's a huge pivot to be able to do that, to take humans out of the loop and really for public and societal benefit. So I think that's one thing that I would say is really just access to the best in class tools everywhere and in a secure, sovereign way.
Okay, great answer, thanks. Lackery, if I can ask you, what change do you think would best allow RPA to create better outcomes in public services in Romania?
Sorry, now?
Yes, if you're okay to step in there. What one shift or change do you think would be positive?
I think the use of RPA will change, first of all, the mentality for the public servant, and using that, the knowledge will be spread into the entire society, and like this, we will interact with each another on shorter ways and with better communication. Now, unfortunately, in Romania, there are lines when you want, as a citizen, to get your rights or to pay some obligations to the state, like taxes and other fees. And in the near future, I hope this to be fully automated, and I wish that for my child to interact with the state only on computer based. So here I think all the state organizations should embark on the use fully secure and sovereign on the data, as Jack said, to interact with the citizen on one part and with the data on the other part. So this is the shift I see in the very near future, and scaling up to all the domains.
Okay, thanks. That's an ambitious vision. Gina, if there's one shift or change that would be positive for better outcomes for citizens of the United States in terms of data automation and what we're talking about, what would that be?
Yeah, I think that's a tough one to pick one, but I think one thing I would change is when you deliver policy changes to agencies, that you give them also a mandate that they must own the outcomes, and the KPIs must also be accounted for. So all policy should have some kind of key indicator that says whether or not the policy did what we thought it should do, some kind of key indicator, because I often feel that feedback loop, at least in the US, to Congress is not really there, nor are the policy stakeholders really prepared operationally to understand the consequences of the policy. Okay, you know, this new experiment we ran, this new type of healthcare plan, well, it actually led to more deaths for X types of people with certain case profiles. You know, that's the kind of thing that people need to hear about immediately and have some kind of action toward. And oftentimes we just forget all about that. And we go ahead and then we're looking to the next fiscal year and we've forgotten the implications of the policy that we've built. So that's one thing I would change.
Okay, great, thanks. That's a great answer. And finally, Miko, if I can quickly go to you, what do you think would support better outcomes in terms of adoption of RPA in the public sector?
I will be coming back to my presentation where I told you guys about our journey and the lessons we learned. So I think RPA is a tool for many uses. So I think it's important that you find the usage for your organization, both from business view and the technical point of view, because it can be used for many things. Integration, like I mentioned in the 4 different types we identified for RPA use cases. There are efficiency, and then there are kind of a quality things you can achieve with it. So you have to position it correct way. And my last slide showed that RPA is one means, and then you have other means also to try to automate and make your processes run smoothly or efficiently. So you have to do this positioning, and I think once you do that, that will help in all the government bodies.
Okay, great. So it's really working out which use cases are best suited to RPA and to other approaches. Great. Okay. Well, thank you to all our panelists. I think that brings us to the end of our webinar. We hope that you found it interesting and useful. So thank you again to our panelists. Thank you particularly to our knowledge partner, NetApp, who supported this webinar and made it possible. And thank you also to our audience for watching, of course. So everybody who registered for the webinar will receive a link shortly, taking them to a recording of the webinar that allows them to watch it on demand. And we will also be producing a written report on the proceedings today, and that will be available on the Global Government Forum website. So it just remains for me to thank our panelists once again. Thank you very much for sharing your expertise and insight. It's been a really interesting discussion, and I hope that members of our audience will enjoyed it and will be back with us for another in our webinar series later on. Thank you all very much.
Thank you. Bye.
Bye-bye.
Bye.
Thank you. Goodbye.
Bye. Thank you.
Thank you.
Bye-bye.
Bye.